right, in you come, Jacko. Do you think we'll start off today with some books or with a game?
As a self-confessed talker, it's no surprise Kate Brigman ended up a speech pathologist.
Now let's come and have a look here.
We work with people right across the lifespan. So that's starting with the little babies that might have difficulty with feeding or have been born premature, then looking at toddlers that might be late to talk, they might have been identified as having hearing difficulties, children that might be looking like they've got some autism or some learning difficulties. Then we also work in adults, people that may have had some type of stroke. So we work right with the little babies right through to the other end.
With 20% of 4-year-olds encountering a speech, language or communication difficulty, the focus is on early intervention.
So the speech pathologist might need to do an assessment and work out what the child can and can't say, what they can and can't do, and then really training and working with the parent.
Put the scary ones together.
Oh, is he a scary one or a good one?
Yes.
Kate's work became personal when her son Jack developed a problem with his speech at 2.
Ironically, I actually went away to the Speech Pathology Australia conference and I came back 4 days later and Jack was stuttering and it was like a bolt of lightning. That's what I did my PhD in. And I know that it can't be caused from his environment. I know that stuttering has nothing to do with the parenting or my husband looking after him for that weekend.
Often kids who stutter can recover naturally without any intervention. So Kate waited for 12 months, hoping he'd grow out of it.
Does this piece go with Optimus Prime?
And then one day he just did a really bad stutter and I thought, no, this is it. We have to do it now. And we literally got the game started, the treatment and the activity. So I became a mother that had to treat their child with stuttering and that was really tricky.
So let's put them all down and then we'll take it in turns. Are we doing mix-ups or will we choose the same ones?
So mix up.
Kate treated Jack with an intensive program, 15 minutes every day over 4 months.
Jack's good. So he's in kinder this year and he's also starting to get ready for going to school.
A baker, fireman, dancer.
Oh, so smooth, I think so.
Most of the time his speech is very fluent. We have had to come in a couple of times because we know stuttering is relapse prone.
Let's have a look. I can see some pants.
Kate had the rare experience of having to use her skills to treat her own child, something she never dreamed of.
Yeah, but he hasn't got real eyes.
He's a chatter, he's a cheeky 5-year-old and hopefully will head off to school and won't sound any different to the other kids, which I guess for a parent, that's what I wanted was just for him to be right for school.